and samples program. The county is significantly improving access to reliable water sources for domestic and irrigation purposes. This initiative is a cornerstone of our strategy to promote climate resilient and sustainable agriculture by reducing dependency on rain-fed farming. This shift not only boosts food security, but also creates new economic opportunities, particularly for women and youth involved in kitchen gardening and small-scale agriculture. The sand dams and sump wells we have constructed will be revisited under the water and irrigation sector later in my speech. Mr. Speaker, in partnership with the national government and development partners, we have implemented a range of projects aimed at building resilience among our farmers. Under the Emergency Locust Response Program, 486 groups in Tharaka, Sikuru, Mumoni, Chuso, Ngomeni, Ngune, Waita, Kibou, and the Mwingi Central wards were supported with the Kenya shilling 79 million for micro projects in pulses, cereals, goats, and pasture. Moreover, a total of 4,381 farmers in 4 farmer producer organizations, and these are Mwekaka in Waita, the Gishu Arimi in Tharaka, Mikaki in Ngomeni, and Goat 2 Farm in Chuso. They all received grants of 500,000 each. These funds were for recruitment of more members and office establishment. The Emergency Locust Response Program also saw the implementation of 8 water projects. These include rehabilitation of Ikaiye Boho in Gomeni and Kalisasi Rock catchment in Mwingi Central, the silting of water pans in Mutingwa in Ichuso and Viva in Ikebou, and equipping and hybridization of boreholes in Masukanoni, in Mumoni, and Masavi in Nguni, benefiting over 4,000 farmers. Under the small-scale irrigation and value addition project, we established 9 small-scale irrigation schemes in Kaui, Gutani, Chomedana, and Mutonguni wards, benefiting 4,456 farmers. We also drilled and equipped 8 boreholes with solar-powered pumping systems in Zombe, Mwitika, Kaui, and in Gutani wards, benefiting 2,324 farmers. Similarly, Mwangeni's livestock sale yard and Mekoma Kaongwa market shed in Adi ward were constructed to improve marketing infrastructure and open new economic opportunities for our farmers. Mr. Speaker and honorable members, through the National Agricultural Value Chain Development Project, we also profiled 229,396 farmers and onboarded 280 youth agripreneurs, 7 per ward, to enhance agricultural outreach. Agripreneurs are persons who undertake business ventures within the agriculture sector, aiming to provide innovative solutions, add value to products, and involve rural human resources. And most of them are youth. Literally all of them are youth. Under this same program, the youth entrepreneurs will link smallholder farmers with farm input suppliers, market off-takers, and financial institutions. In addition, we also issued 21 additional motorcycles to extension officers, bringing the total to 99 motorcycles which are used for extension services in our county, thus improving mobility and service delivery to our people. To ensure access to affordable credit facilities to our farmers through the same program, 40 ward-based circles have also been established. Mr. Speaker, through the collaboration with the Korean International Cooperation agency known as COICA in short. 8 women's groups from 3 wards received 164 water tanks of 10,000-liter capacity each to support kitchen gardening, besides improving household nutrition and incomes. These groups are Kimusi Self-Help Group, Kandai New Generation, Ngunga Farmers, and Kawelu Farmers in Mutomo Kibwea, Mwamba Isioko, and Wekwacho wa Makaiye in Adi, and Mwanzo Mpya Mangelu Ndrikila Mana, and KUDP Mutanda in Ikaui Ward. Under this collaboration, we Kwacho wa Makaiye Women Group in Adi was given and helped with a poultry feed crusher and mixer for the enhancement of their poultry value chain. Mr. Speaker and honorable members, poor post-harvest loss is a significant challenge facing our farmers. Despite their hard work and dedication, many farmers experience substantial losses after harvesting their crops, affecting their income and food security. Leveraging on the establishment of the Kitui County Aggregation and Industrial Park will significantly reduce post-harvest losses. The Aggregation and Industrial Park will provide farmers with access to modern storage facilities, processing and marketing infrastructure, enabling them to preserve their produce, add value, and access better markets. Mr. Speaker, a key constraint we continue to face is a shortage of agricultural extension officers, despite enhancing them. The current ratio stands at 1 officer for every 2,414 farmers against the Food and Agriculture Organization, that is FAO, recommended ratio of 1 agricultural extension officer to 400 farmers. To bridge this gap, my administration will recruit 128 additional agricultural extension and animal health officers to replace those who have exited the service through retirement, designation, or national attrition this financial year. Mr. Speaker and honorable members, I now turn to water and wish to state as follows. And I'll start with a quote. Thousands have lived without love, but not one without water. So goes a common saying attributed to British American poet Winston Howden. Water is critical for sustainable development, including environmental integrity and the alleviation of poverty and hunger, and is indispensable for human health and well-being. Our county, Mr. Speaker, is endowed with many rivers, including major rivers, that is River Tana and River Harvey, as well as 5 river basins comprising Z2 River Basin, and Ziu, Chia, Thua, and Tiva. Therefore, the real challenge in Kitui is not water scarcity, but rather limited accessibility to water. In recognition of this fact, my administration has prioritized the construction of sump wells and sand dams, which are cost-effective, reliable, and sustainable water solutions. Notably, a single sump well has a capacity to yield approximately 200,000 liters of water per day, which can serve an estimated 2,000 households daily. So far, we have constructed 19 sump wells serving over 5,000 households across the 8 sub-counties, including Mwitasiano Kwabonza, Iniata Kwabonza Ward, Imumba in Bochamatu, Kalambani in Mudha, Ndiangu in Matinyani, Yambu in Mulango, Kamekia Kanganga in Tharaka, Kakikilali in Moi, and Tia Wimbondo in Kiomo Chedhani. In addition, a total of 347 sand dams have been constructed across many rivers within the county's 40 wards. Further, to enhance food production through irrigated agriculture, my government has established the 2 solar-powered cluster irrigation projects. These include Kitui Indiani in Kanji Simisi, Kitui Mikeu in Waita, Mamuluni in Chomedana, Mbanze Kaumu in Zombe Mwetika, Mumbuni farmers in Kizumulakwa Mutonga, Muzo farmers in Miambani, and Katangi in Kesasi, among others. We aim to progressively expand the acreage under irrigation from the current 3,900 hectares to 7,200 hectares by the end of the 2025-2026 financial year. We have also, Mr. Speaker, constructed and desilted 60 earthy dams across the county, among them Kwakwai in Endau Malalani, Mokakwa Molu in Moi, Kito in Mutomo Kibwea, Bauni in Chuso, Kikundu in Kiome Chedani, Matiliku in Kanyangi, Kwa Mukuti in Changwithia West, and Kwa Munju in Mutonguni. Mr. Speaker and honorable members, we have drilled 55 and equipped 33 boreholes in strategic locations across the county, benefiting an estimated 8,550 households. They include Gatoroni in the Raka, Miani in Avi, Itoloni in Migwani, Idhoko Showground in Changwithia West, Kanyangi Primary School in Kanyangi, Mutitu Gauge in Mutitu Kaliku, Nyanya Katitika in Waita, and Ikizumula in Ikizumulakwa Mutonga. Additionally, we have solarized the 21 boreholes, significantly improving water access to over 3,000 households. These include Masukanioni in Mumoni Ward, Chanda in Omedhana, Engamba in Nino, Itani in Bo Chamatu, Katuku in Kwa Mutonga Kizumula, Kamu Tianzuku in Moda, Kalinditini in Kisasi, Moda, Kalinditini in Kisasi, and Kwa Kisini Kazungu in Molango. In our efforts to reduce distance covered to access water points, my administration has installed and rehabilitated a total of 134 kilometers of water pipeline extensions across the county. These include Nzeluni Athi Dam to Kilungu Pipeline in Migwani Ward, Tiasambwell to Mboru Primary School in Mwingi Central, Konani kwa Kalondu to Kituasko Manyanyoni in Township, Kaunguni Boho to Mungatu Shopping Center in Athi, Mangola to Kiema Kilonzo Primary School in Chuluni, Kwa Mwatu to Kwa Kamula in Kanyangi, Kwa Mutuku to Sangala Market in Kaui, Matingani to Kwa Kitabi to Kwa Ngungu in Chuso. We have also installed a total of 180 plastic water tanks, each with a 10,000-liter capacity in various public and learning institutions, market centers, and community water points across the county, including NGU ECD in Kibo Ward, Kamutekeo ECD in Ichome Dhana, Munadi Primary in Ikanga Chatune, Chambo Dispensary in Migwani, and Kadhivo VTC in Kwamutonga Kedumla. Mr. Speaker and honorable members, in fulfillment of my campaign pledge to revive, complete, and commission the stored Kangokango water project in Kitui South, we have, in collaboration with World Vision, our partner, developed a new intake, installed modern pumping systems, and installed and rehabilitated key pipeline networks, including the Kamute Mutomo main gravity line, the Mutomo Shunguni Kandai Suma Nzeke Makongoni return line, the Mutomo-Ikudha line, and the Mutomo-Mudha line. We have also installed new valves, replaced 40 ones, and constructed water kiosks at strategic points across Kitui South Sub-County to improve last mile distribution. These Kenya shillings 839.7 million Kenya shillings flagship projects being jointly funded and implemented in partnership with World Vision will provide reliable access to potable water for over 25,000 households. That is 100,000 people, taking an average of 4 members of each household. In Kitui South, and this will be in Kitui South and parts of Kitui Rural Sub-County, once the project is fully operationalized. Specifically, the project will serve 6 wards, that is Mutomo, Kanziku, Mudha, Ikudha, Adi, and Kanyanki. Mr. Speaker, we had earlier planned to launch the Kangu Water Project on 20th June 2025, but due to the ongoing final testing, we have rescheduled the launch to Friday, 22nd August 2025. Regrettably, the implementation of this critical project has been hindered by incidents of vandalism in certain sections. Acts we believe are being perpetrated by individuals acting at the behest of political detractors and development saboteurs who seem bent on denying the people of these areas the enjoyment of piped water access. I wish to strongly condemn these unlawful activities which undermine our collective progress and deny our people the services they rightfully deserve. I therefore call upon members of the public, local administrators, and the security agencies to remain vigilant and promptly report any suspicious activities or individuals to the relevant authorities for swift lawful action. Mr. Speaker and honorable members, the long-term sustainability of our water and irrigation investments required sound governance and professional management. In this regard, water supply schemes, including sump wells, boreholes, and pipeline extensions, are being placed under the management of our 2 main water service providers. That is the Kitui Water and Sanitation Company, or Kituasco, and the Kiambere Mwingi Water and Sanitation Company, or Kimuasco, in Kitui and Mwingi sub-counties respectively, to ensure efficiency and sustainability. I wish now to turn to health, Mr. Speaker and honorable members, and start by quoting an American essayist and philosopher known as Ralph Waldo Emerson, who said, and I quote, "The first wealth is health," end of quote. We all agree with Ralph Emerson that the health of our people is their greatest wealth. Hence, the need to ensure that our health sector is functioning properly. In recognition of this, Mr. Speaker, my government has prioritized health as a key sector in our development agenda, investing in promotive, preventive, curative, and rehabilitative health care to improve the well-being and productivity of our people. To enhance access to healthcare services, we have increased the number of healthcare facilities from 306 in 2022 to 311 in 2025 through the construction, completion, and operationalization of Kitui Dispensary in Mutomo, Kibwea, Kilulu Dispensary in Ichuso, Vinda Dispensary in Membani, Gungi Dispensary in Zombe Mwitika, and the Kangondi Dispensary in Mtunguni. We are also constructing and renovating 34 health care facilities in villages that previously lacked functional infrastructure, such as Kaluluini, Kaliakatuni in Mudha, Gatoroni in Tharaka, Katuyu in Ngutani, Chenge in Kaui, Nya in Yata Kwabonza, Mulangai in Mwingi Central, Kalundu in the Township, Ndili in Ikudha, and Kemela in Gomeni. The board initiative moves us closer to achieving the vision of a dispensary in every village, ensuring equitable access to healthcare services and accelerating progress towards universal health coverage. Mr. Speaker, to enhance access to cancer care services, we operationalize the Pangasile Mchashali Cancer Center at the Kitui County Referral Hospital in November 2023. So far, 3,806 patients have been attended to at the center, with 188 persons currently receiving treatment. Moreover, new outpatient blocks at the Kitui County Referral Hospital, Mutomo, Zombe, and Chuso sub-county hospitals have been operationalized, reducing congestion and enhancing timely consultation and treatment. Mr. Speaker and honorable members, to improve maternal and child health care, we operationalized the maternity theater at Imigwani Sub-County Hospital and equipped another at Kanyangi Sub-County Hospital, increasing by 18 the number of operational maternity units from 81 in 2022 to 99 in 2025. The new maternity units include Kisayani Dispensary in Mutomoki Bwea, Endau Dispensary in Endau Malalani, Diuni Health Center in Kwamutonga Kidumla, Tiba Dispensary in Changuithia West, Usweni Dispensary in Sikuru, Nguni Health Center in Nguni, and the Kalisasi Health Center in Mwingi Central. In our continued efforts to reduce infant mortality, Mr. Speaker, we constructed a 70 newborn unit at the Kitui County Referral Hospital and a maternity unit at Inu Sub-County Hospital in collaboration with the Catholic Medical Mission Board, or CMMB, reducing infant mortality from 47 to 13 per 1,000 live births. Our intensive care unit at the Kitui County Referral Hospital continues to provide critical care, having treated 196 patients to date. The hemophilia clinic has also been instrumental in managing hemophilia, a rare genetic bleeding disorder, for 12 patients. Additionally, plans are underway to operationalize intensive care unit and high dependence units at the Mwingi Level 4 Hospital. To promote rehabilitative care for patients recovering from injury, surgery, or persons with disabilities, we have equipped the Kitui County Referral and Mwingi Level 4 hospitals with essential assistive devices. To strengthen diagnostic services, my government has reinstated the previously non-functional computed tomography or CT scan services at the Kitui County Referral Hospital and completed laboratories in 11 facilities, which include Mutomo, Katulani, Kanyangi, and Chuzo hospitals, and X-ray units at Sikuru and the Kaui sub-county hospitals. Mr. Speaker and honorable members, in our efforts to enhance emergency response and health care delivery, my administration has rehabilitated 9 ambulances, raising the operational fleet to 26. We have also ensured the consistent restocking of essential drugs and non-pharmaceutical supplies across all county health facilities, thus strengthening uninterrupted service delivery. Moreover, in response to the persistent threat posed by snake bites, particularly in high-risk areas, my administration has equipped 96 healthcare facilities across our county with life-saving and snake venom. These include Kitui County Referral Hospital, Katulani Sub-County Hospital, and Mikuyuni Dispensary in Kitui Central, Malalani Health Center, and Zombe and Mutitu Sub-County Hospitals in Kitui East, Kase Health Center and Sikuru and Kamuongo Sub-County Hospitals in Mwingi North, the Tani, Winziei, and Nzawa Health Centers in Mwingi West, Nyani Dispensary and Nguni and Ukasi Health Centers in Mwingi Central, Kivani Dispensary and Diuni and Itulia Health Centers in Kitui West, Mudha Health Center and Ikanga and Ikuda Sub-County Hospitals in Kitui South, as well as Mbitini, Kisasi, and Kwabonza Health Centers in Kitui Rural. Other initiatives, Mr. Speaker, include the completion of stored mortuaries at the Kitui County Referral Hospital, Mwingi Level 4 Hospital, the Tani Health Center in Ikiomedhana Ward, and the Yata Health Center in Yata Kwabonza Ward. Going forward, we will fast-track the implementation of the Facilities Improvement Financing FIF Act 2023 to enhance mobilization of local resources, thus ensuring sustainable funding of our healthcare facilities. Mr. Speaker and honorable members, as President Nelson Mandela, South Africa's first African president, observed, and I quote, "Education is the most powerful weapon which you can use to change the world," end of quote. In our continued effort, Mr. Speaker, to provide a conducive learning environment for our children, we have constructed 179 ECD classrooms, benefiting over 7,300 ECD learners across the county. We have also supplied a total of 2,040 colored tables, as well as essential teaching and learning materials to ECD centers countrywide, benefiting over 53,000 ECD learners. Our ECD learners continue to benefit from the motivated workforce of the 1,688 ECD teachers whose terms of engagement were converted into permanent and pensionable on 1st July 2023. Through the Propua Fee Support Program, Mr. Speaker, we have disbursed a total of 244.8 million Kenya shillings to support that 1,573 learners from economically disadvantaged backgrounds in universities, colleges, secondary schools, vocational training centers, and special needs institutions. Mr. Speaker and honorable members, skills development is a foundation of empowerment. When we equip our youth with practical hands-on skills, we are not just training workers. We are building innovators, problem solvers, and leaders for tomorrow. In our county vocational training centers, or VTCs as we call them, we endeavor to equip our youth with relevant hands-on skills. These efforts have borne fruits as evidenced by the increasing enrollment in vocational training institutions, which has more than tripled, Mr. Speaker, rising from 2,506 trainees in 2013 to 8,003 in 2025, an increase of 219.4% since the advent of devolution in 2013. Mr. Speaker and honorable members, urbanization is not just the growth of cities. It is the engine of economic transformation, social progress, and innovation. We recognize this clarion call that the future is urban, as urban centers increasingly support more people and generate more employment. Urban areas also are the hubs for innovation, investment, and economic transformation, hence vital in shaping a more inclusive and resilient future for our residents. In recognition of this, we have undertaken deliberate and strategic interventions to modernize our urban centers through infrastructure investments, spatial planning, and service delivery to improve quality of life and stimulate trade and growth. To achieve the business environment in our urban centers, we rolled out the Dustless Towns program, starting with the tarmacking of streets in Chusiani Market, Yatakwa Ward. And in the current financial year, we are set to expand this initiative to other key trading centers which may not be covered by some of the roads the national government will be undertaking, beginning with Sikuru Town, as we work to create cleaner, more accessible, and investor-friendly urban spaces across Kitui County. Additionally, we have enhanced pedestrian safety in our urban areas by constructing cabro paved walkways in Mwingi and Kitui municipalities and tarmacked the 500-meter St. Usla to Ngutu Idhoko Showground road, including walkways and drainage systems for the same. In pursuit of cleaner, healthier urban environments, Mr. Speaker and honorable members, we are constructing 13 ablution blocks in various urban areas such as Kase, Nu, Thokoa, Kwabonza, Zombe, Mutitu, Ikanga, Mudha, and Kabisuni to improve public sanitation standards. To strengthen solid waste management, we procured a skip loader, a dump truck, and 21 fabricated skip bins for use in Kitui and Mwingi municipalities, as well as in Mutomo and Chuzo towns. Further, we constructed a perimeter wall around the Mwingi town dump site to secure and manage waste disposal activities. To ensure orderly growth and sustainable development, we are preparing land use development plans for Kanyangi, Kabati, Zombe, and the Migwani towns, alongside the preparation of 16 market layouts to enhance land use efficiency and protect public land from encroachment. Additionally, we have finalized the Mwingi Municipality Integrated Development Plan to guide structured planning, zoning, and prioritization of development initiatives, particularly as we look ahead to implement the Kenya Urban Support Program in the near future. As part of our long-term vision for coordinated and sustainable development across Kitui County, we have allocated funds in the 2025-2026 financial year budget to commence a formulation of our county spatial plan, which is a critical framework that will inform physical and socio-economic development countywide. Mr. Speaker and honorable members, turning to roads, we note effective road transport systems are vital for rapid economic growth. They connect people to opportunities, goods to markets, transportation, and communities to essential services. To improve our road network, we have graded over 4,000 kilometers of roads across the 40 wards, easing mobility for over 50,000 road users per day. We have also opened and widened more than 500 kilometers of roads across the county, thereby opening up remote areas and connecting them to the rest of the road network within the county. To date, we have gravelled a total of 27.8 kilometers of roads, among them Seikuru Nzanzeni Usueni Road, which is 12.3 kilometers in Sikuru, Thananzao Kithioko River Road, 1.2 kilometers in Kiomedhana, Kinakoni Imali Kiangini Kiwauni Road in Pochamatu, which is 2 kilometers, and Kwambuvi Mwangeni in Adi, which is 2 kilometers. Mr. Speaker, we have also constructed 41 drips, including River Kase drift along the Kase Musosia Road, which is 150 meters long. In Mumoni, Kithioko River drift along the Kithioko-Thananzau Road, which is 140 meters long in Kiomedhana. Gunga River drift along the Kisayani Imwange Kilui Road in Mutomoki Buya, which is 70 meters long. Dhua River drifts along Kinakoni Emale Kiangini Chukuni Market, which is 150 meters long and is in Chamatu. Kisii River drift along the Inyo Chamusibi Road, which is 90 meters long in Chuluni Ward. Moi River drift, which is 40 meters and it is in Moi, and the Masyungwa drift along Kalambani Kairungu in Chuso. In addition, we have constructed 11 slabs along various roads throughout the county to improve motorability. Some of these slants with a total allocation of 445 million in our budget, which you approved. Unfortunately, the implementation of the Vital Infrastructure Program was delayed due to a protracted court case concerning the disbursement of the funds. I'm pleased to report that the matter has now been resolved in favor of county governments, and as a result, the national government has released through the Kenya Road Board 152 million Kenya shillings to Kitui County to enable us to initiate phase 1 of the road maintenance levy program. 15 out of the proposed 45 roads have been prioritized for implementation under this phase, and we await the disbursement of the remaining funds, which are over 290 million, because initially there were 445. Some of the targeted roads include improvement of Kanyangi, Kanyongonyo Junction, Ndovoini, Zambia Road in Kanyangi Ward, upgrading of Kalimbui Junction, Kakauni Southeastern Heritage Center Road in Sekuru Ward to bitumen standards, construction of Mudhungwe Maskalini, Imumba Police Station Road in Ibo Chamatu, construction of Mudhue Mwangala Kanziku Road in Kanziku Simisi, including a box culvert at Kwavai, and construction of Waluku Vinda Makan in Dibuni Road in Miambani Ward.